Well, in follicular lymphoma, of course, patients relapse and then have multiple relapses, and at each line of therapy, physicians have choices as to what type of therapy they then offer. CAR-T therapy, of course, now has become one of the options available, but of course it comes at a relatively high price in terms of the morbidity and mortality in terms of offering that therapy. That's not different from what people expect to do in diffuse large B-cell lymphoma, where you're comparing it to platinum-based therapies and autologous stem cell transplant. But in follicular lymphoma, it's a very different type of side effect profile. So what we did was perform an analysis asking physicians what were the factors that were important to them in making decisions about treating patients in later lines of therapy. And in particular, asking them how were the side effect profiles associated with things like CAR-T or bispecific antibodies, that is cytokine release syndrome or neurological toxicities. How did they factor into how a physician would think about offering those types of therapy? And as you might expect, if you've got a patient who has a very indolent disease, physicians' choices were usually we want to have the most gentle therapy that will produce a response. But as you got on to later and later lines of therapy, physicians were more willing to be able to accepting higher toxicities, and we're looking for durability of responses and having a better response. We also observed quite subtle differences from country to country and from continent to continent about how physicians would rate each of the toxicities. And also factors like if patients had very short remissions first time round, in other words a POD24, how that might impact upon how physicians would think about later on lines of therapy. And of course, as you might expect, what happens then is that patients and physicians, the patient analysis is coming later. We won't be showing that in the abstract here at ASH this year, but I know some of the data that's already coming in. The higher the risk up front, the more people are willing to take rather a bit of a chance in terms of some of the toxicities to gain the benefit from what we are seeing. In the end, of course, in both the presentations we have on looking at later stage treatment for follicular lymphoma, people do want to see the randomized clinical trials, which are of course ongoing, but will take a long time to read out in these disease settings.